Hello, fellow anatomists. Let's get started. So let's talk about arterial blood supply. On the list on the right, you can see the four main arteries of the pelvis and perineum. We're going to focus on the internal iliac. So the common iliac divides into an external and an internal branch. What's important about the external iliac is it gives off the inferior hypogastric artery. Now looking at the internal, it divides again into an anterior and a posterior division. In the posterior, we have an iliolumbar, a lateral sacral, and a superior gluteal, which exits out the greater sciatic foramen. On the anterior side, it gives way to an umbilicus, a superior vesicle, and off of that in males is the ductus deferens. Then we have the obturator, which exits out the obturator foramen. In females, we have a uterine and a vaginal, and in males, we have the inferior vesicle. You have a middle rectal, as well as an inferior gluteal, which also exits out the greater sciatic foramen. Now looking at the pudendal, which is the largest supplier of the perineum, exits out the greater sciatic foramen, wrapping around the sacrospinous ligament and through the lesser sciatic foramen to enter the perineum. This gives off an inferior rectal as well as a perineal, which of this branches off the bulb of the vestibule or the penis, as well as the posterior labial or scrotal artery. Continuing down, we give off the urethral, as well as the deep and dorsal arteries of the penis or clitoris. And here's a fully labeled diagram that you can pause the video and take a look at. So in general, veins follow arteries, except veins have various plexuses and no anterior or posterior division. In the pelvis and perineum, most drainage is going through the internal iliac and their tributaries, and it's important to note where these plexuses lie, including the rectal, the vesical, and then either the prostatic or uterine vaginal. Now these all unite and drain into the internal iliac. Also important to remember the portal caval anastomosis, with the superior rectal portion being the portal contribution and the inferior and middle rectal being the caval contribution. In the pelvis and deep perineal pouch, lymph drains into the internal iliac nodes and then moving into the lumbar nodes. One exception is superior rectal, which drains into the inferior mesenteric nodes. In the superficial perineal pouch, it drains into the superficial inguinal nodes. One exception is the gonads, which drains into the lumbar nodes following the gonadal arteries. Thanks. Happy studying.